Abortion is often stigmatized in cultural or religious beliefs, and in South Africa the law sometimes works against those who want to abort, but women have the right to make this choice. Let's talk to Dr Tlaleng Mofokeng, Special Rapporteur to the UN about this, speaking to us from Kwakwa. Very good morning to you. Remind us of what our rights are here in South Africa and other parts of the world.
Good morning. It's very important when we're speaking about South Africa particularly to always remind everyone that, in fact, our Constitution is a great document that uses human rights standards as its framework. And once we have that Constitution, it's much easier to draw from it and make policy and make any legislation because we are already coming from a human rights framework. This is not the same in other countries. And in my role as the UN Special Rapporteur, part of the role and the mandate is to advise any legal or any legislative changes that should be happening globally in different countries and member states that will improve access to sexual and reproductive health, including access to safe abortion. And in some instances, it's not even only a legal reform or the issue of hostile laws. It's also issue of access to clinics and trained health professionals as well.
Okay.
But everyone has that right.
Okay, so if somebody needs it in this country, whether they've been, they didn't want to have a child, they've been raped, there's been some sort of unfortunate incident that's led to a pregnancy, or there's some sort of medical condition which could prove fatal for the mother of the child, what do they do?
So our law in South Africa, which is the Choice on Termination of Pregnancy Act of 1997, states that anyone who's pregnant has a right to decide whether they want to terminate or not. Between the weeks of 0 to 12, you actually do not need a condition. You can go on request and ask for this procedure to be done. You could be someone who feels that, even if there was no trauma or any other, horrific incident that led to that pregnancy, it may not be supportable for you for many other reasons, and you are able to do that. You should be presenting yourself to your local clinic or the nearest hospital. If for whatever reason they cannot help you, they should be able to refer you, and people need to insist on a referral letter to go to the next referral hospital using the existing networks in the public health sector. You should be able to get a history taken from you. Someone must confirm a pregnancy using your last normal menstrual period, or a pregnancy test using a urine test or a blood test. And in some instances, where indicated and where it's accessible, they may use an ultrasound. But it's not absolutely mandatory. With your last menstrual period and a pregnancy test urine, it's enough for you to be able to give in the care that you require.
Okay, so regardless of what the reason is, if you want to have an abortion, you can. I mean, one of the problems in this country is the stigma attached to it, and I should imagine that has a negative impact on many women who therefore go for illegal abortions.
Absolutely, and it's especially important to ensure that we think of other people who find themselves in vulnerable situations, or those who have historically been subjected to discrimination, and stigma enables discrimination to happen. So if you think about adolescent girls, migrant women, women with disabilities, LGBTI people, and people of gender diverse persons, it means that they have an even harder obstacles that they need to navigate to get this access. And stigma, unfortunately, is so systemic, and the anti-choice politic and the anti-choice posturing of both the providers themselves, but the system itself means that this has become now an individual women's struggle. And I think it's important for us to hold governments across the world accountable and remind them of their obligations to ensure that the right to health is realized, and the services around safe abortion, around family planning, around contraception are actually not a favor or an added extra.
And can I just jump in here and ask you briefly, because we run out of time, and also the right to have access to condoms?
Absolutely. And right now with COVID-19, what we know for sure is that many African countries are struggling with supply of reproductive health commodities and safer sex tools, such as the male and female condom. They are now both called the external and internal condom, because there is no African country that produces its own condoms. All of us on the African continent, on the region, are dependent on imports. And countries are firstly prioritizing their own needs in country. And we know with COVID-19, the production and how the economies and freight have been impacted. So we have to rethink about the dependence of African countries on imports for really essential services and essential needs of their populations.
Tlaleng Mofokeng, very good to talk to you. And, you know, I didn't know that. I mean, it's something that you'd think that African countries would take on the own production of something so important. Thank you.